Hello dear friends, how are you doing today? Welcome to another question about dermatology. A 34-year-old man presents for the removal of a mole, where on the body a keloid scars most likely to form. A. Sternum, B. Lower back, C. Abdomen, D. Flexor surfaces of limbs, and E. Scalp. This question is asking about the most common size of the body for keloid formation, and the most common size for keloid formation of the body is sternum, then shoulder, the neck, face, and extensor surfaces of the body, and then the body itself. Okay, we are going to explain it. Keloid scars are most common on the sternum. Keloid scars. Explanation. Keloid scars are tumor-like lesions that arise from the connective tissue of a scar. It's important. Keloids rise from the connective tissue of a scar and extend beyond the dimensions of the original wound. Predisposing factors for keloid scar formation is ethnicity, more common in people with dark skin. Keloid, we can usually see these keloid scars on the people with dark skin. Occur more commonly in young adults and are rare in the elderly. In the young adults it's common, but in elderly people the keloid scar formation is rare. Okay, common sites in order of decreasing frequency. First common site is sternum, and the second common site for keloid formation is shoulder, and the third common site is neck, and the fourth common site is face, and extensor surface of limbs is the fifth common site, and trunk is the sixth common site of the body for keloid formation. As we can see here in this photo, we can see keloid scar is formed in the sternum of this patient, and here we can see keloid scar is formed in the shoulder of this person, and here we can see keloid is formed in the neck of this person. As we said, keloid formation is very common on patients with dark skin, and here we can say it. And in this patient with dark skin, the keloid is formed on their face. Here we can see the keloid formation in their body and in the extensor surface of this patient's hand with a dark skin. Okay. Note, keloid scars are less likely if incisions are made along relaxed skin tension lines. And this is important if we are going to do any excisional surgery on the patient's skin. We must note that this excision must be alongside the skin tension lines for the decreasing the risk of keloid scar formation. Here we can see the skin tension lines. This photo is showing skin tension lines. If the excision is done on the line of these lines, then the risk of keloid formation will be decreased. Okay. Treatment of keloid scars. Early keloids may be treated with intralesional steroids. Example, triamcinolone. Triamcinolone will be useful in the first in the early stage of keloid formation, but if the keloid formation is prolonged and is formed and it's in the body, in the size of body which is visible, and the beauty surgery is important for that part of the body, then excision is sometimes required. Okay, here was a short explanation about the keloid scar formation. Thank you for your attention.